Welcome to Module 1, Lesson 7. Up to this point, you've built a strong foundation. You've learned what interpreting is and is not, the core terminology of the profession, why language access matters legally and ethically, the defined role of the medical interpreter, and the difference between scope of practice and advocacy. Now we shift from understanding to execution. This lesson focuses on applied practice, how to stay in role when real people, real emotions, and real pressure enter the room. As the saying goes, it is easier said than done. This lesson is designed to help you apply what you have learned so far. As we move forward, I want you to picture each example and scenario as if you were the interpreter. Let's examine this. Transition to practice. Knowing the standards is essential, but professional discipline is proven in moments when boundaries are tested. The scenarios in this lesson are designed to help you recognize those moments and respond correctly. As you watch each scenario, pause and think before moving on. This reflective step is critical to developing real-world judgment. For the first scenario, we'll be looking at direct pressure from a patient, a situation many interpreters encounter early in their careers. Before we proceed, we want to name our characters. Joshua, medical interpreter. Michael, healthcare provider. Patient can just be a patient, but an LEP patient. Now, Michael faced the patient and said, based on your test results, one option is to start medication. The medication can help manage your symptoms, but it also comes with possible side effects, including dizziness and fatigue. Joshua interprets accurately into the patient's language, preserving tone and medical register.
Com base nos resultados dos seus exames, uma opção é iniciar a medicação. A medicação pode ajudar a controlar os seus sintomas, mas também pode causar efeitos colaterais, como tontura e fadiga.
The patient responded, asking the interpreter direct question.
Estou com medo, não sei o que fazer. Você fala a minha língua. Diga-me honestamente, o que devo fazer?
The patient says, I'm scared. I don't know what to do. You speak my language. Tell me honestly. What should I do?
Joshua interpreted exactly without adding or softening. Why this response is correct? Joshua does not. 1. Give advice. 2. Reassure the patient. 3. Share a personal opinion. By interpreting the question instead of answering it, Joshua keeps the decision where it belongs, with the provider and the patient. Let's go through the second scenario. Michael, the doctor, says, I've explained the risks, benefits, and alternatives several times. I told you not to put stress on your leg and to remain in a wheelchair for the time being.
Já expliquei os riscos, benefícios e alternativas diversas vezes. Disse-lhe para não sobrecarregar a perna e para permanecer na cadeira de rodas por enquanto.
Certo. Pensei que, já que não sinto mais dor, poderia ficar sem. Talvez eu considere essa possibilidade.
Okay. I thought that since there's no pain anymore, I could do without it. Maybe I'll consider it.
Joshua interprets the response accurately. Provider turns to interpreter after the exchange and said, Joshua, do you think the patient really understands? I don't think she is ready to abide.
I can interpret the information again or request clarification from the patient if needed.
Why this response is correct? Michael does not. 1. Judge patient understanding. 2. Assess readiness. 3. Offer clinical opinions. He stays within scope by offering language-based support only, despite working within the same healthcare setting. Now to the third scenario. Michael, the healthcare provider, faced the patient and said, we need to discuss your test results.
Precisamos discutir os resultados dos seus exames.
Isso é ridículo! Ninguém me ouve. Estou cansada de ter medo e de ser tratada como se não importasse.
The patient says, this is ridiculous. No one listens to me. I'm tired of being scared and treated like I don't matter. I want another doctor.
Why this response is correct? Michael does not. 1. Soften the language. 2. Remove emotional content. 3. Apologize on behalf of the patient. 4. Reframe the message. Emotion is part of meaning, and it must be interpreted completely. Now to the last scenario for this lesson. We recommend starting this treatment as soon as possible.
Recomendamos iniciar este tratamento o mais breve possível.
Na minha família, acreditamos que o corpo deve descansar antes de tomar remédios fortes.
In my family, we believe the body should rest before taking strong medicine.
Michael, the provider, appears confused. What does that mean exactly? The interpreter, even with knowledge of the patient's culture, does not explain the situation based on personal understanding. Instead, the interpreter accurately conveys what the provider said so the patient can clarify the information herself. Why this response is correct? Michael does not. 1. Explain cultural beliefs. 2. Interpret intent. 3. Act as a cultural advisor. If explanation is needed, it must come from the speaker, not the interpreter. Languages spoken in this lesson are used for illustrative purposes only. We've come to the end of this lesson, but let's take some reflection. Self-check questions. Take a moment to reflect honestly. Did you feel tempted to help beyond interpreting? Which scenario felt most challenging? How did emotional pressure affect your instincts? How does staying in role protect both the patient and the interpreter? These reflections strengthen professional self-awareness, an essential skill for long-term practice. This applied lesson reinforces one central truth. Professional interpreting is not about doing more. It is about doing exactly what the role requires, consistently and ethically. The ability to stay in role under pressure is what separates trained professionals from well-meaning bilingual helpers. With applied practice complete, the next lesson will focus on ethical dilemmas, situations where the correct path is not immediately clear, and interpreters must rely on professional standards to guide their decisions.